Amanda come up to the podium and join us and explain why we're here today.
Okay, let me get myself sorted here. Well, welcome. Thank you all for coming and being here today. My name is Amanda Villaveses. I am the Director of Mental Health Blue. And if you're not familiar with Mental Health Blue, we are a community mental health wellness hub. And Mental Health Blue was started in around 2018, 2019 as a way of connecting the community to the providers that we have within Louisville and surrounding areas. So what we noticed was that we have a plethora of resources in our community, but people don't seem to know how to access them, which is why we're here today. We've been building this database for providers for a while now, and we're continuing to build it and develop it as a way for people to have easy access to the providers in their community. And we're able to use this database to help people find a provider for them, and if they aren't able to find who they need on the database, they can connect with us directly so that we can help demystify this process. So one thing we know is that if you haven't experienced some kind of anxiety or depression or mental health issue in the past few years, you're pretty lucky, because we've seen increases of depression and trauma, things that are still people carry with them every single day, even as we're kind of getting back to some semblance of normal. And we want to make sure, with our partnership with public health, that we are able to help the community access the resources they need to help with healing and to help them process some of these things. And also just break the stigma that mental health, is something for, not for me, it's for other people. It's a problem other people have. We want people to recognize that it's a very normal experience to have mental health issues at some point in your life. And so, with that, I want to actually bring up one of the providers who's listed in our guide, who's been a great partner with us throughout the years. And I want to bring up Lauren Muir of Martin & Muir Counseling and many, many other things.
Right. Thank you, Amanda. All right. Good morning, everybody. So my name is Lauren Muir, and I'm a licensed professional clinical counselor supervisor. I'm also the co-owner of Martin & Muir Counseling, which is a mental health agency here in the city that primarily services youth, adolescents, and families. We say we do a non-traditional type of therapy because 98% of our work is done in home, school, and community-based settings. We primarily serve West End Louisville, so over 76% of our clients reside in West End Louisville. I'd say about another 12% are in South End Louisville. So we really try to gear our work towards breaking the stigma and bringing mental health in non-traditional settings or communities where people usually don't have access. Over the past 3 years, we've had a unique experience because we started in 2016, but in 2019 we grew our clinical team and added therapists and case managers. And then shortly after the pandemic hit, and then there was civil unrest in the city with Breonna Taylor, and things have just grown ever since. So one of the things I wanted to talk about is what we've seen. So we've definitely seen an increase in depression and anxiety, as Amanda mentioned, definitely an increase in trauma, and also an increase in grief and loss. And that is from a wide variety of things. So one being the increase in suicide rates over the pandemic or over the past 3 years, and then also an increase in adolescents and youth is who I mainly work with, but they have lost people to gun violence, whether that be their friends, family members, or people just in their classroom that they maybe don't know so well, but they knew them just from being by them day to day. And with the population that we serve, some of the barriers that we see, one is really just lack of knowledge, which is why this directory is so great, to give people a direct point of access to go look providers in their community, or people that look like them, or people that specialize in certain things such as anxiety or trauma or depression. Because what you don't know, right? And so some people don't realize that it's very accessible to find a provider by going to places like this directory or your local church or your local school or things like that. Another potential barrier is funding. So some people don't have insurance, or they don't know that their insurance covers certain things, especially for people that are on Medicaid. Therapy is covered 100%, and a lot of people don't know that because there's this idea that mental health is so expensive. You know what I mean? So I think Amanda does a great job over at Mental Health Blue in letting people know how to access resources and how to make sure that's paid for, so it doesn't prevent you from getting the help that you need. Also, when Mental Health Blue asked me to kind of think about, like, why is this important? Why does our community need it? Research shows that one of the most important things about a person in therapy is their relationship with their client. So that person can be the smartest person using the best theory in the world. If they can't connect and build that rapport and have a relationship with their client, the therapeutic journey is only going to go so far. So the benefit of a directory is that you, like I said before, can search by race, you can search by gender, by their specialty, by what zip code they're in. And so it really starts off like personalizing the person you're choosing to be there for you in a time of need. And I'm always an advocate of partnerships. So I love this partnership. Partnership is like at the heart of what I do. And so Amanda and I have partnered on a lot of different things, and I believe that when the community comes together, that's when we make our biggest differences. As a sole provider, I love working with people one-on-one, but some of my greatest accomplishments have been through community partnerships. So I'm so excited to see the city on board with Mental Health Blue and so many providers signing up to make sure that we get the community the help that they need during a very critical time. Thank you.
Thank you, Lauren. Yeah. And so as you can see, Lauren is one of our providers, and that it's also important for providers to come out of their solo practice. Let that go for a second. I like to think of Mental Health Blue's directory as a way of not just benefiting the community, but also benefiting providers in that we are able to help burst the bubbles that we as providers kind of live in and help us connect more with our community and understand our community's needs. And speaking on someone who knows a lot about community and community needs, I would like to introduce, I want to make sure I say it all, T. Gonzalez, sorry, slipping papers, who's the director of the Center for Health Equity here at LMPHW. Come on up, thank you.
Well, good morning, everyone. Like it was said, my name is T. Gonzalez. I'm the director of the Center for Health Equity at the Louisville Metro Department of Public Health and Wellness. Our role at the center is to really be thinking about the ways in which social conditions, social and economic conditions can impact the public's health. And certainly our mental health is not divorced from some of those impacts. While we do not provide mental health services at the department, we know it's critical for us to partner with those who are providing those services and those who are advocating for expansion of those services and greater supports across our community, because your mental health and your physical health are so closely tied together. We know that when we have a better state of mental health and wellness, we're maybe more likely to be able to monitor some of our chronic conditions or prevention of those chronic conditions, there's a cyclical kind of relationship there. So we want to make sure that we're thinking about the health and wellness of the entire person. We know that, as has been discussed, that there are so many systemic barriers to creating positive mental health and well-being in our community. Some of those things have already been discussed. During this pandemic period, we know that so many have experienced great changes when it comes to employment or housing. We've had a lot of stress and trauma related to the calls for racial justice in our community and that movement. And so we know that we have to be thinking about those things at Public Health and Wellness. The Community Wellness Hub and the Mental Health Provider Directory is a larger part in this community of expanding and really supporting mental health services here in Jefferson County. At the Department of Public Health and Wellness, we're excited that we've been able to secure these $400,000 in federal grant funds through the American Rescue Plan. to go towards enhancing mental health services across our community. And you know, mental health services in large part is one of the ways that we can also work towards preventing one of the more serious health outcomes, which could be death by suicide in our community. And we want to take seriously preventing suicide in our community. We know that in 2022, through our coroner data, across residents and non-residents, we had 174 deaths by suicide in our community. We know that that loss is too great and it will continue to be felt in this community for a long time. And we want to have a goal of reaching 0 deaths by suicide in this community. And so we need more supports like Mental Health Lou to be able to make sure that all of us are being able to attend to our mental health and wellness needs in this community. And with that, I would like to invite my colleague Ben Goldman up to talk a little bit more about the services and the parts of this initiative that the $400,000 will be funding.
Thank you, Tate. I'm Ben Goldman, the Community Health Administrator for the Behavioral Health Equity Team at the Center for Health Equity at Louisville Metro Public Health and Wellness. And our team, the Behavioral Health Equity Team, doesn't provide direct services around mental health. Our focus is population level health outcomes around mental health and substance use. So we look at health outcomes and try to identify and address inequities we see mostly related to the root causes of health and the social determinants of health, contributing to inequities in how populations experience mental health and substance use. So this team includes folks working in overdose prevention, suicide prevention, the criminal legal system, and our work around suicide is spearheaded by our suicide prevention specialist, Chelsea Burton, who wasn't able to join us today, but whose hard work is the reason that we have been able to get up and running with this community mental health and wellness hub, and the reason we'll be able to move forward with our additional suicide prevention efforts. The spending package the team mentioned that was supported by the Mayor's Office and Metro Council and the Louisville Accelerator team targets $400,000 of American Rescue Plan dollars to invest in supporting the mental health of our community and reducing the number of deaths by suicide we see. In addition to the resource hub, it will include a Suicide Fatality Review Board that convenes suicidologists and other stakeholders to review every single death by suicide in our county to identify trends, risk factors, and potential interventions, as well as post-interventions after a death by suicide to reduce the risk of additional loss. It'll also include a community prevention plan. Building on our success from the COVID-19 community partner work, we've partnered with community agencies that serve populations our department has struggled to reach in the past, including communities of color, immigrant and refugee communities, and the LGBTQ+ communities, and residents with substance use disorder and in recovery for substance use disorder. These are some of the populations where we've seen increases in deaths by suicide. And so rather than us as the government trying to step in and do this work, we recognize there are community partners who are already supporting the mental health of our residents, and that our best path forward is to partner with these trusted community partners, trusted community organizations, and work with them to build additional education opportunities for residents, listen to residents, and have sessions where we hear what folks' struggles are and what kinds of interventions they'd like to see, and then work with these groups to have targeted messaging campaigns. That's the last piece of this suicide prevention project, which is the communications campaign, where we'll be taking the findings from both the Suicide Fatality Review Board and the community partner work to have some messaging around both reducing the stigma of mental health services and reducing the risk of suicide of our residents. The past few years have been hard for most, if not all of us, working in this field and living through the pandemic. There are times that I felt alone and hopeless, but we're not alone, and we don't need to be hopeless. There are many community partners. We are a community filled with providers and community partners who are ready, willing, and able to support our mental health. And we're lucky to have that, and I'm very excited that this project can help bring those providers and those partners a little closer. I'd like to invite Amanda back up to close us out.
All right, so let's do a little demonstration of what this looks like at this moment. Currently, our provider database is in English. However, the website can be translated to Spanish. We do have bilingual therapists listed on a separate resource page, and we're able to assist people if they contact us directly for those needs. So what one will do is head over to our website, and then we'll go to find a provider. And then on the filter side, you'll see that there is a zip code. The zip code needs to be entered so that we can have an idea of location. And this database does not collect individual user information, but it does give us an idea of if, say, a specific zip code is looking for depression services over and over and over again. And then we can kind of start to look at that zip code and maybe send specific services or work with public health to better understand what's happening within that community. So the individual will type in their zip code. So go ahead and put in any old code. They can look by services. They can look by modalities. They can look by insurance. Why don't you go ahead and just pick a service? Okay. And we have probably the most comprehensive, one of the most comprehensive lists of services that you might find on a site like this. We worked hard to try and include as many things as possible and go to feedback through other people in the community. So which one did you select?
I did crisis counseling.
Okay. And so you have Amanda Gullett. Maybe you click on read more. So here is information about Amanda. And as we continue to build and bring in more providers, these searches will expand. You'll have more and more providers. And if you click back, what you can do is if that individual isn't the therapist you're looking for, you can return to the search, or you can clear the filters and start over. We also have a list of therapists that kind of pop up initially. So if you want to just explore these therapists, you can do that. If you want to click on like Andrew Swan. He's a really happy looking guy.
I was like, there are okay, I see.
There he is. And so again, there's Andrew's information and contact. And if, as I said, if people are not able to find the provider that feels like a good fit for them, they're then able to contact us, and we will be the middleman and help find the correct or the best provider for them, and within roughly about a week's turnaround time. Are there any questions? Yes.
Hi, what is the criteria for providers to be on this website?
So thank you for asking that, actually, yes. So providers submit their information, and then we make sure that the information is accurate, that they are credentialed or licensed before we put their information into our database. We want to make sure that we don't have any providers on there who maybe are listing false information or a false license.
And then are they guaranteed to have openings, or is it possible that they may be fully booked?
No, there are no guarantees with openings. That is a little bit of hard data to kind of keep updated constantly, because providers would have to actually come to our site and update it. That is actually one of the benefits of us kind of stepping in, is if you contact a provider and the provider you want isn't available for, say, 6 months, you can contact us directly, give us the criteria you're looking for, and then we actually have a network where we go into our network and say who's available, and we can find people more immediately.
And I understand this was, so we did a story back in November that referenced this resource. So I'm just trying to understand what the news is today. Has it been expanded since November, or?
The database has been updated and expanded,
Okay.
and this is all part of our partnership with the city, so that is the news for today.
And then, so there was an initiative in November where the Office of, I think neighborhoods, I can't remember which office it was, but they were offering, like free counseling services to people in certain neighborhoods, I think.
Mm-hmm.
How does this interact with that?
Well, so that would be that's a separate thing when they're offering those free services. But if people are looking for low fee or free services, they can use our database. There is a section where they can filter by fee. And again, if they can't find what they're looking for, they can always contact us to help route to that. We also, when there are free services offered, such as that, we will promote that as well on our social media and in our newsletter to let people know what information is available. Because besides being just this provider research, let's say we don't have any events listed at the moment, but we will host or list events. We'll partner with schools to do mindfulness fairs. We'll do we have our speakers collected where we bring mental health workshops into businesses or schools. So we do a lot more than just the database, but that's what we're talking about today.
I've got a question.
Yeah.
Amanda, you can take this, right? It was something that Lauren had said, so either of you, if you want to do this, but you all had mentioned that you had seen an increase in depression and trauma.
Mm-hmm.
Do you think that, I'm sure that there were the pandemic and several factors that led to that, but do you think also part of it is just more of an increase in people breaking down that stigma and being willing to talk about it, and an increase in people willing to try these things to improve their mental health?
Absolutely. I think one thing about the pandemic that in a way benefited this conversation about mental health is that suddenly everybody was experiencing it, and so it became a lot easier to start talking about it. And many of the people that I saw during that time, who maybe became new clients during the pandemic, depression didn't start at the pandemic. It had started way before then. But they were now in a place where people are talking about mental health. Everywhere you turn, it's people were saying, take care of your mental health. Here's how to take care of your mental health. And so I think that was actually very beneficial in breaking down some of that stigma and normalizing the fact that we all have ups and downs, and for some individuals it lasts longer than others, and for some it's even much more complicated than that, and it's okay to talk about it.
Can you speak at all to, in particular, our community experiencing the gun violence over the past few years, hitting triple-digit homicides, how that has impacted people and their concerns when they come to you all?
Mm-hmm. I actually want to pass that to Lauren, because just speaking from my practice versus her practice, I think your practice has much more experience with that. Do you mind answering that?
Okay, can you repeat your question?
Yeah, so you had mentioned gun violence being something that people were coming to you to try to cope with and work through. Can you talk particularly our community has struggled with that issue over the last couple of years? What have you seen?
Yes, most definitely. I think the biggest thing, because we work closely with the Department of Juvenile Justice, then like I said, we're in the school system. And so, I'm trying to think of the best way to say this, gun violence it may be centralized to like certain neighborhoods, right? That's what we see a lot, but it really impacts the whole community. I think a good example of that is the young man that was killed on the bus stop, and he was at Eastern High School. That whole school was impacted, whether you were that kid's best friend that stood on the bus stop every day, or you were just the kid that happened to be in PE class with him. It has so many rippling effects. But then there also, for the family, there's a lot of different dynamics that go into that, just not dealing with like the grief and the loss, but just the safety in general. Because then you have people, there's retaliation, and, people are still tied to certain things in the street. So it's just like these rippling layers of effects that have to be addressed. But definitely the grief and loss. I just did, I hear about it and I see about it one-on-one, but I think I had an eye-opener yesterday, actually. It was at PRP High School, and I had 16 girls that came for grief. and the majority of them were affected by gun violence. And that was like, it just take, it's different when you see it. Like, it's right in front of your face and you see it versus like hearing it on the news. But it is a community problem and a community issue. So I love seeing that, like Amanda said, more people are like talking about it and stepping up. I think one of the biggest things different in our practice, most of our clients are Black or African American, but to see the number of adult African American males that have came to therapy over the past 2 to 3 years has been amazing to see, because that shows that like we're changing. You know what I mean? That people are evolving, they're wanting to talk about it, and it's okay to not be okay and to talk about it. Just like you would talk about your physical health.
Yeah, that's the thing. And speaking on that, Kristen, do you mind pulling up that slide one more time? Say, in addition to our, Mental Health Lou as a resource, of course, there's the new 988 national line. You can always text Lou to 741-741, and 7 counties has 24/7 hotlines that you can call to receive services. And so I want to encourage people, if you see this and you are looking for a provider, if it's something immediate, you have these services, you can contact us. There are services out there and resources out there in our community to help you heal and to help you grow and process whatever it is you need to process and work through. Any other questions?
Earlier you mentioned that if someone maybe themselves can't find a provider, that you often get them hooked up to someone in about a week. I recall when things were really bad, maybe a year and a half, 2 years ago, a week turnaround time would be impossible.
Right.
Is that something that you all are able to provide, maybe different from others, or have things just kind of caught up a little bit better at being able to handle the load that the industry has to handle?
I would say it's a little bit of both. I think that more and more providers are having a little bit more space within, they're not as busy. But still, most are pretty busy, which is why people hit those walls of people who aren't available. But I think that does make us unique because as a provider myself, that means I have this connection to this vast network. So even providers who aren't listed on our site or who have yet to kind of join our site, we're able to reach out to this big network and find a good fit. And we know about things too, we know about free services, we know about students who are able to see clients, we know about those things that other people maybe don't. And that's why, we're focused on Louisville, which I think is what makes it that week turnaround time a little bit faster than maybe any other organization. Thank you. All right.
And I do want to clarify one thing. I think on the press release, it links to that original link.
Oh,
So,
we need to update the link.
yeah, I'll update the link, but just so you all know, I'll go back to, because you actually, Amanda, if you go just to find a provider and you click on this,
And
I
then-
think it takes.
Yeah, if you go to find help, and then it's there. And that's the page, yeah. Yes. And actually, do you want, I don't know if you want to, we can update that, but if you want to click find a provider, under quick resources and Black mental health providers, those two have been some of our most used pages as well for individuals who are just kind of looking for something, or they're not looking to search really, they just maybe want a list for their office so that they can refer people.
I have a quick question, because I know you spoke a little bit about how the impact of gun violence has impacted people's mental health, but I spoke to a few activists about the issue when it comes to homicides in our community, and they explained, how to put it, that it's not just how it's affecting people, but also when people are in situations like that, sometimes mental health plays a huge role in how someone acts in a high intense situation. So I was hoping somebody can just expound a little bit about that too. Like, is it more of just like not know how to resolve a high intense situation, or people just feel like, their best option is to just pick up a gun? So I was hoping.
Yeah, I think there are a lot of factors that come into play when it comes to gun violence and the individuals who commit gun violence. And we have to look at, it's very common for people to say, oh, mental health, right? And yes, mental health is definitely a factor. because that person, you know, so often we hear people were bullied or people were, you know, came from a home where there was, say, abuse or something like that. So there obviously are mental health factors at play. Other factors, of course, are, is a gun accessible? You know, the impulse is a really big thing when it comes to gun violence. And if you have a gun that's really easily accessible and you are in a mental health state or you are quite fragile, you know, that's where we see suicide with guns. We see gun violence in our community. So I would say it definitely plays a role, and it is something that we need to work on as a community. I also feel like culture is a big piece of it as well, and something that, you know, culturally, if we can support and encourage people, take care of each other, you know, if we see somebody who's being bullied, if we can assist them or if we can help people know that they're cared for and loved, that can help minimize, you know, some of the violence that we see in our communities. And I know that sounds a little, you know, maybe a little too Susie Sunshine or something, but I really do think that compassion is something really important. And when people are struggling within our community, if we can be preventative about it, you know, versus punishment and, you know, just really further increasing maybe the issues that that person is experiencing, we might be able to see some decrease in that. Of course, that's my opinion.
And I know for a lot of people, especially in the Black community, going to a counselor, going to a therapist is kind of like something that you feel comfortable about. You know what I mean? Especially if it's somewhere that you don't live or somewhere that is unfamiliar to you. It may be just an uncomfortable situation. Yeah. So if somebody does choose this and decide to go online, try to find a provider, what would you say to them, those people who feel uncomfortable with the whole concept of therapy?
Yeah, often I tell people, you know, just feel it out. You're in charge, you know. A therapist is not there to take your secrets and, you know, use them against you or anything. We have confidentiality. And so helping people understand you're the client. You go in, you can test this out, try it out. If it doesn't feel like a good fit, you have the right to leave, you know. I want people to feel empowered when they go in. It shouldn't be a shameful thing that people are experiencing. And also know that, you know, if you feel more comfortable seeing a provider who looks like you, who maybe has a similar background to you, they exist. You know, there's plenty in our community. And if they need help finding it, obviously that's what we're here for. You want to add to that? Go ahead.
Can I add to that? Sorry.
Yeah.
I can do that, but I'm doing it. No.
You're good.
So I just wanted to say, to your point, I think a lot of times also in our community, Black people are often referred to therapy because they're involved in some type of system or program. Like the courts are telling you you have to go to therapy. CPS is telling you you have to go to therapy. You got suspended too many times at school, you have to go to therapy. So I think a lot of the work that that we do and other therapists is to let people know, like people just go to therapy because they choose to go to therapy. Some people, things are going great in their life, but maybe they're going through like the work transition and they're not sure how to handle that, or maybe their kid went away to college, you know what I mean, things like this. So it's okay to have a therapist even when you're not in crisis. And I think a lot of times people don't recognize that in certain communities because you're always being told what to do. So just to piggyback on what Amanda was saying, it should be an empowering process. Like if you don't like your therapist, you have the choice to say, yeah, we're not really a good fit and I'm going to try somebody different. So I just want people to know that.
Thank you, Lauren. Okay. Any other questions?
Oh, sorry, one more. So where's the funding come for this, the website?
So as Ben mentioned, this is part of the, what is the title?
American Rescue Plan.
Oh,
American Rescue Plan, thank
Part
you.
of that 400,000.
We did not get 400,000, to be clear.
The city did.
The city did,
Okay.
yes.
And is this part of city government, mental health blue, or are you a nonprofit?
We are our own entity. We're our own complete business.
Right. And are you for-profit or nonprofit?
So actually there's two sides of mental health. Lou, a nonprofit, and a for-profit side. We just recently launched our nonprofit in February, and are shifting everything into the nonprofit realm from the for-profit realm.
And to Ruben, I don't know if you want to further explain the $400,000, so about roughly 50,000 have gone to mental health leave so far.
That's correct. And the remainder is for those other projects I mentioned, the Suicide Fatality Review Board, the Community Prevention Plan, and the Communications Campaign.
Thank you all for coming today. I do have sticky notes for you all because I know that if any of you need to contact us, you are welcome to. I'm very aware that in the field of news, there's a lot of pressure. There can be vicarious trauma. There's a lot happening. So if any of you need us, let us know, okay? Thank you.